Why are fluoroquinolones used as second-line TB drugs? Have you ever wondered why certain medications are used for treating tuberculosis, especially when the usual ones don't work? Let's dive into the role of fluoroquinolones as second-line drugs in tuberculosis treatment. Fluoroquinolones are powerful antibiotics that target Mycobacterium tuberculosis, the bacterium responsible for tuberculosis. They are particularly useful when the first-line drugs, like isoniazid and rifampicin, fail due to drug resistance. First-line drugs are the go-to treatments for drug-susceptible tuberculosis. However, when the bacteria develop resistance, which can happen in cases of multidrug-resistant tuberculosis or MDR-TB, we need alternatives. This is where fluoroquinolones come into play. Medications like moxifloxacin, levofloxacin, and gatifloxacin are considered core second-line agents. They effectively reduce the bacterial load in tuberculosis lesions, which is crucial for recovery. One of the standout features of fluoroquinolones is their excellent oral bioavailability. This means they are well absorbed when taken by mouth, making them convenient for patients. They also tend to be well tolerated, and their cost is relatively low to moderate, which is beneficial for widespread use. Moxifloxacin, in particular, has shown the ability to reach higher concentrations in tuberculosis lesions, potentially enhancing treatment effectiveness. However, it is essential to use fluoroquinolones carefully. If they are used improperly or as standalone treatments, there is a risk of developing fluoroquinolone-resistant tuberculosis strains. This resistance is a significant concern, especially in extensively drug-resistant tuberculosis, or XDR-TB, which is much more challenging to treat and often leads to poorer patient outcomes. To prevent resistance, fluoroquinolones are typically reserved for second-line use and are integrated into combination treatment regimens. This approach helps maintain their effectiveness while addressing drug-resistant tuberculosis cases. The careful management of these medications is crucial to improving patient outcomes and ensuring that they remain as effective for future patients. In summary, fluoroquinolones serve as second-line tuberculosis drugs because they effectively combat drug-resistant strains, are well absorbed and tolerated, and can be part of comprehensive treatment plans for MDR-TB and XDR-TB. However, their use must be monitored closely to prevent the emergence of resistance. Always consult healthcare professionals for personalized medical advice regarding tuberculosis treatment.